The following segment contains sponsored content. The opinions and views expressed belong to its sponsors and not those of Nexstar Media Incorporated, this station, or their affiliates or employees.
Welcome back to Loving Living Local. I'm Gretchen Wirtz, and today we are getting healthy and getting back to school. Yes, fall, back to school, it's all right here. And today we are talking with MyCare Express Care and Dr. Jabran Nasir. Thank you so much for joining us.
Good to be here.
Yes, so MyCare Express Care is over there in Bloomington, and you started this up about a year ago. What made you branch off and do this?
Well, I've worked at a local hospital for a number of years. I was a primary care doctor for 6-7 years. Then I started urgent care medicine. I had good experience in that. I love that field.
Yeah.
But eventually I thought it should be something that I built from scratch. I built from a clinic that I can show my kids. They have a lot of interest in medicine. They all of them want to go and be a doctor. So I thought we'll give it a shot and make our own clinic, and I think that's a wonderful thing for the community to have more options.
More options, definitely. All right, well, today we're kind of talking about back to school, the flu, fall season, all of that kind of stuff. What is flu season? Everyone gets this mixed up. There's the different type.
Right.
How would you best tell us the
So
difference?
when you say flu season, we typically think about just that in winter time.
Yeah.
But actually, flu or influenza virus is year round. It's all the time there. We actually check for a lot of times in patients who show those symptoms. But typical flu season is your winter time when people are inward, in their house. A lot of schools and there's outdoor activities are less, so there's more communicable diseases. So influenza kicks up. But flu season is not just influenza, it's other viruses like COVID. Last few years we've seen, last couple of years, RSV has been a big thing that you might have heard. People get croup. It used to be a children's disease, very young babies used to get it, 2-3-year-old kids, but now it's in adults as well.
Okay. So a little bit, about how do you tell the difference between that, and when do you know if you should do something more than just...
So the main thing is your diagnosis, your early recognition. So your symptoms are very, very similar in a lot of these viral infections. So from a patient point of view, they'll always just have like body aches and congestion and cough. But most of these infections, they do have some differentiating factors. In flu, mostly people will have very high fevers. They'll have really bad body aches, and then you'll have the cough, congestion as well. With COVID, you'll have fevers, but not as high, and mostly it'll be very bad headaches initially. You'll have some loss of taste and smell. That's a lot of times very common, and along with that, more cough, sore throat, congestion develops as well. Really bad fatigue is a big factor that can last weeks, by the way. RSV typically happens in younger kids, but it can happen in adults as well. And that's more, again, chest. People wheeze a lot. They have more chest congestion. And along with that, you can have low-grade fevers as well. So early recognition and differentiating is very important. That's why you want to contact your doctor as soon as you get any symptoms like that.
Because there are treatments and there's ways to deal with these symptoms, but it's different for all of them, and it's important to come in and find out exactly what you have.
And unfortunately, you can't cure them. Even in this day and age, we don't have cure for these viruses, so that's why when a doctor tells you, well, it's just a viral illness, so for you, you still have to go through it. But symptomatic treatment is still there. If you have a lot of cough, you have a lot of chest symptoms, that still needs to be addressed.
If you would like more information, you can, of course, go to mycareexpresscare.com. Give them a call at 319-2393 over there in Bloomington. We look forward to having you on again. Thank you so much.
Thank you very much. Appreciate you having me.
Back to school. Stay healthy.
The preceding segment contains sponsored content. The opinions and views expressed belong to its sponsors and not those of Nexstar Media Incorporated, this station, or their affiliates or employees.